All right, we're going to study together. So I've taken a year of nursing school, and you're 12. Yes, we were right.
Yay.
We're going to study together because maybe you'll be a nurse. You're
I don't
kind
know.
of thinking about it, maybe. What topic would you like to study?
Are they all of these topics?
I believe so.
It's a lot.
You want to study elimination?
That sounds like some Hunger Games thing.
That means peeing and pooping.
Oh, okay.
That was funny.
Does
You're
it?
like, Hunger Games? No, just peeing and pooping. All right, we're going to study together. Do you want to help us learn about elimination?
Well, there's naked torsos.
That was the stages of breast development, Emily.
Okay.
This is nursing. You gotta learn that.
Yeah, I know.
Do you want to learn about responding to emergencies, mass casualties, and disasters? That sounds kind of fun.
Oh, sure.
Sure. Okay, 691. Are you ready? What are you doing?
I'm signing to editing Dad.
What did you tell Dad?
I just said hi, Dad.
Oh, nice of him. All right, are you ready? 3 hours ago, a client was thrown from a car into a ditch, and he is now admitted to the emergency department in a stable condition with vital signs within normal limits, alert and oriented with good coloring, and an open fracture of the right tibia.
I was about to say he seems pretty fine.
For which signs and symptoms should the nurse be especially alert?
What is a tibia?
It's,
It seems like it would be over here.
I think it's one of these bones here.
And
And open means it's broke through the skin.
Oh no.
Okay, so which signs and symptoms should you be alert for? Hemorrhage, infection, deformity, or shock?
What's hemorrhage?
I mean, if you are hemorrhaging, that's blood. That's losing too much blood. If you're hemorrhaging, you're not going to have normal color.
If it's open and you were just yeeted from a car, I feel like you'd be scared there'd be infection because,
Infection
ditch,
seems like a
mud.
thing. Obviously, there is deformity.
Yeah.
Shock is when, like,
Doesn't it say seems alert and oriented?
alert and oriented sound like he's not in shock.
Yeah.
So, you want to go with infection because we know he's currently not hemorrhaging and he's not in shock. And obviously he's deformed if he has an open fracture. I feel like that's just you're deformed. Okay, hold on. Where's one? Okay. Because I have to try to hide the answer. 2 is what we picked? Yes! We were right. Infection. Because of the degree of contamination of the open fracture and the time that has passed since the accident, the risk of infection is very high. Therefore, the nurse should be especially alert for signs and symptoms of possible existing infection or early signs of infection, such as debris in the wound site, temperature abnormalities, results of the laboratory studies, such as complete blood cell count and wound culture and sensitivities, or heat or redness around the room. Because of the client's vital signs and cardiovascular status are stable at this time, hemorrhage is not the priority. Hold on, I don't want to see the answer to these other ones. Or concern. The client is talking coherently at this point, so as mentioned does not suggest he is in shock. However, assessment for signs and symptoms of hemorrhage and shock would certainly be ongoing. The fracture would be corrected by surgery as soon as possible, thereby minimizing the risk of deformity. All right.
I don't know why he was thrown out of a car though.
Like a car accident. He hit another vehicle.
I was
A
just
person
imagining
didn't throw him
somebody
out.
beating- How do you know?
Because I don't know. Okay. Number 2, a client is admitted to the emergency department with a full thickness burn to his right arm. Upon assessment, the arm is edematous. Fingers are mottled, and radial pulse is now absent. The client states that the pain is 8 on a scale of 1 to 10. The nurse should administer morphine sulfate IV push for the severe pain, call the physician to report the loss of radial pulse, Continue to assess the arm every hour for any additional changes. Instruct the client to exercise his fingers and wrist.
What does edematous mean?
I think swollen.
What does radial pulse do?
So that's feeling your blood flowing through, and they can't feel the blood flowing through.
Shouldn't you tell the person that?
That seems like an important thing.
Yeah.
There's no blood getting to their hand. That would mean, that's what I would see that as. So I'm thinking it's called a physician to report the loss of radial pulse.
And they don't care if you're in pain at first.
Pain is not priority.
Yeah, that's
but
the last thing they do.
I feel like it would be the second thing. If they are in a lot of pain. Yeah. You do want to get them morphine. I feel like you probably want to give them morphine, but I think you would let the doctor know they don't have a radial pulse first. You know with that too. We think 2.
Again.
2!
Yay.
Circulation can be impaired by circumferential burns and edema caused by compartment syndrome. Compartment syndrome is where like your body swells and things die from broken bones or something. And I guess burns. I don't know. I need to learn more about compartment syndrome. Early recognition of treatment of impaired blood supply is key. The physician should be informed since an escharotomy, incision through full thickness eschar, is frequently performed to restore circulation. Pain management is important for burn clients, but restoration of circulation is the priority. Assessments should be performed more frequently. Exercise will not restore the obstructed circulation.
What's eschar? I forgot.
It's the black. It's black nastiness that like covers a wound. I don't know what it is. On pressure sores, it literally just looks like gross black nastiness. Dad, show a picture of a wound with eschar here. It's gross looking. If there's eschar in a wound, you can't tell how deep it is.
Oh.
So if they're gonna debride the eschar, you're holding a fish. So that the pressure's relieved. Okay, you ready?
Okay.
A middle-aged man collapses in the emergency department waiting room. The triage nurse should first gently shake the victim and ask him to state his name. What's your name, sir? Perform a chin lift to open the victim's airway. Feel for any air movement from the victim's nose or mouth. Watch the victim's chest for respirations.
You don't know very much about him, really.
Someone collapses. I feel like I probably learned this in CPR class.
You should see if he's breathing first, right?
Well, if you shake him, will he come to? I don't think it's...
but shaking him isn't that urgent.
It's not performing a chin tilt. That's part of CPR, but you're not there yet. I feel like you check the pulse.
Well, there is no pulse option for some reason.
Yeah. Or you shake him. Are you okay? I actually think it's 1, but the other thing would be feel for air movement to tell if they're breathing. What do you think it is?
I feel like it's feel for air movement. Because,
okay, you're going with 3. That's my second choice.
If he's, totally out and you need to perform CPR and you try to shake him, that's kind of just wasting time.
Yeah, I'm going with 1, though. You talk to him. 1. Calling the victim's name and gently shaking the victim is used to establish unresponsiveness. You're making sure he really is unresponsive. The head tilt, chin lift maneuver is used to open the victim's airway. Feeling for any air movement from the victim's nose or mouth indicates whether the victim is breathing on his own. The rescuer can watch the victim's chest for respirations to see if the victim's breathing. Okay, number 4. That was a good guess, though. That was my second guess. Often my second guess is the right one. Okay, proper hand placement for chest compressions during cardiopulmonary resuscitation, CPR, is essential to reduce the risk of which complication? Gastrointestinal bleeding, myocardial infarction, emesis, rib fracture.
I only know what rib fracture is.
Emesis means vomiting.
Okay.
Myocardial infarction means heart attack. Gastrointestinal bleeding means somewhere in your digestive system is bleeding. Proper hand placement for chest compressions will reduce the risk of what? I know this one.
Probably rib fracture.
You will break the ribs during CPR, most likely.
But we're decrease the
risk, maybe. I think it's 2. It's a heart attack.
I mean, isn't that why you're doing the CPR so they don't have a
Yeah.
heart attack?
Yeah.
Yeah.
I don't know. I could be wrong. Or you were right. Proper hand placement during chest compressions is essential to reduce the risk of rib fracture, which may lead to pneumothorax and other internal injuries, and then you need a chest tube. Gastrointestinal bleeding and myocardial infarction are generally not considered complications of CPR. You were a key there. You're like, that's not a complication of it. That's why you're doing it. Yeah. You're right. Although the victim may vomit during CPR, this is not associated with poor hand placement, but rather with distension of the stomach. We're both 3 for 3, right?
Yeah. Are we?
Yeah. So I've taken a year of nursing school, and you're 12.
I mean, I'm asking you what all the words mean.
And we've both got 3 right. Number 5. The American Heart Association guidelines urge greater availability of automated external defibrillators, AEDs, and people trained to use them. AEDs are used in cardiac arrest situations for early defibrillation in cases of atrial fibrillation, cardioversion in cases of arterial fibrillation, pacemaker placement, early defibrillation in cases of ventricle fibrillation.
I don't even know what fibrillation means.
It's irregular heartbeats. So in Chicago Med, when they're doing like the little electrocute things on the chest, when they're doing that, like, or chest compression, someone always like, stop when it's been too long, and then they tell the doctor in charge that doesn't want their patient to die, he's in, and I don't remember if they say B-fib or A-fib.
What does it? Does it just mean he's dead now?
Yeah.
What?
Yeah.
Why do they need such fancy words?
So atrial is the top chambers of your heart, and ventricle is the bottom chambers of your heart. It's either 1 or 4, but I don't know. And I can't even remember what they say in Chicago Med. Stop, he's in. It's 1 or 4, and I don't even know which. And I feel like early defibrillation in cases of, it could even be what they said in Chicago Med. We're going to learn. I'm going to pick 1. It's 1 or 4. I'm going to pick 1. 5. It's 4. Womp, womp, womp. Early defibrillation in cases of ventricular fibrillation. The American Heart Association places major emphasis on early defibrillation for ventricular fibrillation, and the use of AED is a tool to increase sudden cardiac arrest survival rates. Okay. AEDs help with
I
VFib.
touched my eyelash.
Ew!
What?
Your eyeball?
I touched my eyelash.
Oh, that's okay.
It made my eye itchy.
Oh. You grossed me out for a second.
Okay,
Okay, indicate on the illustration below where the nurse would place the other electrode of the automated external defibrillator on a victim who has collapsed and does not have a pulse.
His neck.
Yeah, it's like right up here in the middle.
I don't know.
I think it's in the middle
Do
right
nurses
here.
do this?
Anyone can do this if you're CPR trained. It's somewhere here.
What if I'm not CPR trained and somebody just...
There's directions that tell you, and there's pictures, honestly. It's somewhere where my finger is, but that is covering a large portion of him. It's somewhere between the middle and left. I feel like it's like right in the middle. Sternum, like kind of slightly above the nipples. Let's see. I would have killed him. I mean, it's left. I said left. I meant my left, his right. I was pointing at... My finger was covering the X. You can clarify, right?
I mean, sort of.
Yeah. I mean, I put my finger here, but I was thinking more where my nail was, and it's more where...
Does it have to be on his right?
Yes. Yeah. This one goes under his heart. I said left, but I meant my left, his right. Yeah.
Right.
But I didn't have it far enough to his right. I had it a little more center. I think I've got 3 right out of 6.
I don't know. I haven't been keeping track.
A client is... I think you've got as many right as me or more.
But you've been telling me the words.
A client is... She's so humble. Look, we're really sinking down. I look like a giant. The client is admitted to the emergency department after being found in a daze walking away from her burning car after an accident. She was not injured in the accident, but the other driver died. She states, "I can't handle it anymore. There's no point to it at all." The crisis nurse recommends hospital admission based on the identification of which priority nursing diagnosis. Ineffective coping related to burning of the car as evidenced by walking around in a daze. Decisional conflict related to burning of the car as evidenced by lack of knowledge of what to do next. Disturbed thought process related to causing a death as evidenced by inability to think clearly, or at risk for suicide related to traumatic events of an accident as evidenced by statements of helplessness and hopelessness. You know it. 4.
I mean, that's the most serious one that you would actually be able to.
Yeah. Hospital admission, because she's definitely a risk of suicide. Okay, 7 is 4. 4. Right. The client is demonstrating helplessness and hopelessness during a crisis as evidenced by the statement, "I can't handle it, there's no point to it." Common factors associated with suicidal ideation. Must be hospitalized to ensure the safety of herself. Those diagnoses, the other ones have less priority. Disturbed thought process would be evidenced by delusion, such as the devil set my car on fire, not just by the inability to think clearly. Alrighty. 8. Mass casualties. Several clients have come to the emergency department after a possible bioterrorist act of arsenic overexposure. The nurse should assess these clients for which signs or symptoms following the poisoning. Select all that apply. Arsenic. Violent vomiting, severe diarrhea, abdominal pain, sensory neuropathy, persistent cough.
What does number 4 mean?
Trouble feeling like that because your nerves are shot. Like you get it if you have diabetes. That's why sometimes people with diabetes don't have a foot. Do you remember seeing the lady with no foot in the nursing home when you were little? You were scared of her. She had her foot cut off because of diabetes.
How was I scared of her?
Because you'd never seen a person with their foot cut off and it just looked a little creepy to you. Okay, I wonder if watching the musical or the play Arsenic and Old Lace would have helped us with this. I've seen it, but I don't remember the symptoms of that.
What play?
Arsenic and Old Lace. It's about an old lady that killed people with arsenic, and then she would bury them.
It's like a crazy pyromaniac.
Yeah, I think so. Okay, I'm not real sure. I think arsenic poisoning. I'm going to go with 1, 2, and 3. Vomiting, diarrhea, and abdominal pain.
What is arsenic poisoning? Is it just like another...
It's a poison. I don't think... I mean... Would you inhale it? If you would inhale it, then I guess it'd be persistent cough. But... I really don't know.
Can you turn it into a liquid?
I mean, an arsenic and old lace, I think they ate it. I'm going with 1, 2, and 3. Do you want to make a guess?
1.
Just 1? It's select all that apply.
Oh, select all.
You can pick all of them if you want.
1, 2, and 3 makes sense then.
It might be persistent cough, but I'm not going to pick that one. Might regret it. 8. 1, 2, and 3. Yay! When arsenic overexposure occurs, the symptoms include violent nausea, vomiting, and abdominal pain, skin irritation, severe diarrhea, laryngitis, and bronchitis. Well, okay, laryngitis and bronchitis. Dehydration can lead to shock and death. After the acute phase, bone marrow depression, encephalopathy, and sensory neuropathy occur. Persistent cough is not a sign of arsenic exposure. You might have laryngitis, but not a cough. And you would get sensory neuropathy, but that's later in the game. We got it right. 30 people are injured in a train derailment. Which client should be transferred to the hospital first? A 20-year-old who is unresponsive and has a high injury to his spinal cord. An 80-year-old who has a compound fracture of the arm. A 10-year-old with a laceration on his leg. A 25-year-old with a sucking chest wound.
What's laceration? What's...
Laceration's a large cut.
Okay. What's a sucking chest wound?
I think it's where ribs are fractured, and when someone breathes in, you see, like, a dent.
I feel like the 10-year-old's gonna be okay.
I mean, you could bleed to death if it's bad enough, but...
But compared to the rest of them, the 10-year-old's probably okay.
I feel like a broken arm is probably okay, too.
And he's old anyway.
This person needs to be transported very carefully because of the... And they're unresponsive. I mean, he's unresponsive. I'm going to go with the unresponsive, but that sucking chest wound sounds scary.
Yeah. I think 4.
You think 4 and I think 1. You know, if you get it right again, you should just take the NCLEX for me. 9.
I think I would fail.
4! You were right. You're getting more right than me. Guidelines offer priorities for immediate, delayed, minimal, expectant care. The client with a sucking chest wound needs immediate attention.
Because that's like an injured lung, right?
And will likely survive. The 80-year-old is classified as delayed emergency response. Personnel can immobilize the fracture and cover the wound. The 10-year-old has minimal injuries and can wait to be treated. The client with the spinal cord injury is not likely to survive and should not be among the first to be transferred to the healthcare facility.
Wow.
Okay, then.
It's like, yeah, we'll just let you die.
Yeah. I was not expecting that answer. Okay, then. I mean, if he's most likely to die and there's other people's lives can be saved, it does make sense, but that's not what I was going to guess. All right. You got it right. You got more right than me on this. 12-year-old is beating nursing student on NCLEX questions. Humble 12-year-old is beating nursing student on the NCLEX. An explosion at a chemical plant produces flames and smoke. More than 20 persons have burn injuries. Which victim should be transported to the burn center? Select all that apply. The victim with chemical spills on both arms. Yeah. The victim with 3rd-degree burns of both legs. Yeah.
I don't think number 3 is that bad.
The victim with 1st-degree burns of both hands, like it's mild enough that they don't need to go to the burn center because urgent care could take care of 1st-degree burns. Yeah, I agree with you. A sunburn can be a 1st-degree burn. The victim in respiratory distress.
That doesn't seem like a burn center thing.
No, and the victim who inhaled smoke needs to see respiratory, but not their skin. That's not a skin thing. I think just 1 and 2. You think just 1 and 2, or you want the inhaled smoke one to go there? That's my iffy one.
Chemical spills, how do you know that's a burn?
Chemicals burn your skin.
Do it all count?
I mean,
what if it's
an explosion at a chemical plant? Sounds like it was a... Yeah. I'm saying 1 and 2. What do you think?
I mean, it has 2 for sure.
I was wondering a 5, but I think I'm leaving 5 off.
I'm not doing 5.
I'm not sure if burn centers treat smoke inhalation. I mean, they kind of should, I guess, but I'm just final answer 1 and 2.
Okay.
10. This is our last one. I only do 10. Oh my goodness. No, we were supposed to send everyone but the 1st-degree burns.
Everyone?
Yeah, respiratory distress and inhaled smoke as well.
I feel like they could go somewhere else to get treated better.
Here's why. Victims with chemical burns, 2nd and 3rd-degree burns over more than 20% of their body surface area, and those with inhalation injuries should be transported to a burn center. The victim with 1st-degree burns of his hands can be treated with first aid on the scene and referred to a healthcare facility. My guess is burn centers, because obviously anyone who's like had their skin burned, they also have ability to deal with respiratory. All right, well, are you smarter than Emily? Did you get more right than Emily? Because I didn't. Do you guys want to do this again? Emily's thinking about going to nursing school or medical school or something. Maybe, maybe not, but she keeps showing off. If you want to take more NCLEX questions with Emily, leave a comment below.